Hi everyone, this is Harshita. Welcome to Teddy Guides You channel. So there are three types of investigations that we randomly do for any kind of kidney diseases. First one is immunofluorescence, second one is light microscopy, and the third one is electron microscopy. So in the renal, whatever you are learning, you must know the specific things that are present in the immunofluorescent, electron microscopy and light microscopy of the kidney. Okay, for example, you are learning about the post streptococcal glomerulonephritis. You must know that what are the substances or what are the abnormalities that are present in the immunofluorescence, or what are the things that we gonna observe in the immunofluorescence investigations of the immunofluorescence, light microscopy and electron microscopy. For example, you are learning about the post streptococcal glomerulonephritis. In that, you must know what are the abnormalities or what are the substances that we see in the immunofluorescence, electron microscopy, and light microscopy. So, for every disease, you must be very sure that what are the structures that you are seeing in these three investigations. Now, let's discuss what we can see in the electron microscopy. Here, MC means mesangial cells. This is the image directly taken from the Robbins. MC means mesangial cells. MM is mesangial matrix. Here this is the basement membrane. EP means epithelium. LRE means laminar rara externa. LRE. Laminar rara externa. Externa. LD means lamina densa. LRI means lamina rara interna. EN means endothelium. And here lamina rara externa, lamina densa and lamina rara interna, these three compose together to form glomerular basement membrane. This is the endothelium and this is the podocyte which are present in the epithelium. Okay, I hope you are clear up to now. Now let's discuss in electron microscopy. For example, a patient is suffering with membranous nephropathy. In electron microscopy, you can able to observe some of the immune complexes that are deposited. So these are the immune complexes that are deposited in different places in the glomerulus. So depending on the position or the location of the immune complexes, you can identify or you can diagnose the disease very well, very easily. So for that case, it is very important to send the kidney biopsy to the electron microscopy. Okay, so now let's discuss some of the cases in which you can see the depositions of the immune complexes. For example, in the first case, these are the immune complexes. These immune complexes are present in the subepithelium. So in the first one, they are present in the subepithelium. Subepithelial humps. These are called as the subepithelial humps. They are mostly seen in, let me change the color. They are mostly seen in acute glomerulonephritis. In the coming classes, we will discuss everything about the renal system. Don't worry. Acute glomerulonephritis. And the second one is, these are the second one. They are present epimembranous. They are present on the membrane. So they are epimembranous humps. They are present in two conditions like membranous nephropathy and hymen glomerulonephritis. And the third one is, these are present subendothelial deposits. Third one is subendothelial deposits. They can be mostly seen in diseases like lupus nephritis, like SLE, membranoproliferative glomerulonephritis, membranoproliferative glomerulonephritis. And the last one is mesangial deposits. Fourth one is mesangial deposits. So these are present in the mesangial matrix. Hence they are called as the mesangial deposits. So these are the mesangial deposits. Fourth one. They mostly present in the IgA nephropathy. Okay. So these are the important points that you must remember. Okay. Now let's discuss some of the important points that you will observe in the immunofluorescence. These are the two structures that are related to the immunofluorescence. Okay, so in the immunofluorescence you can observe linear pattern and the granular patterns. You can observe the linear patterns and the granular patterns. So they are depending on the immune complexes. Here the total game will depend on the immune complexes. So these are of two types. First one is linear, second one is granular. So in granular there will be accumulation of the immune complexes or the complement depositions, because of which they appear to be granular. For example, if you observe this, it will be granular, which implies that there are some of the depositions because of which immunofluorescence is showing in this way. And if you observe this, it will be linear. So here there will be absence of granules. Okay, so in the this is the linear one, this is the granular one. So in the linear pattern, glomerular basement membrane is affected. So this is also called as glomerular basement membrane diseases. In the diseases, so in the glomerular basement membrane diseases, you can observe linear pattern of the immunofluorescence. For example, Goodpasture syndrome. So this is the type 1 disease of rapidly progressive glomerulonephritis. So here anti-basement membrane antibodies are present. Glomerular basement membrane. Anti-glomerular basement membrane antibodies are present. And the second one is granular. And the second one is granular. In this granular, you can observe the depositions of the immune complexes. So immune complexes are present here. So these can be easily identified in the post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis. Okay, so these two are related to the nephritic syndromes. So these are the structures that you can identify in the immunofluorescence. And the most important one is light microscopy. So what are you going to see in the microscopy? In the light microscopy, you will observe the cellularity, like whether the glomerulus is enlarged or whether it is hypercellular or any accumulation of the neutrophils. So these are the structures you will identify in the light microscopy. You will able to differentiate whether the total or whether the entire glomerulus is getting affected or any focal part, means less than the 50% of the glomerular is getting affected or greater than the 50% is getting affected, or entire segment is getting affected or a bit of the segment is getting affected. So this is the idea that you will get from seeing the light microscopy. Okay, so let's discuss some of the important points about the light microscopy. Light microscopy. This light microscopy, there are different types of strains that you're gonna use. First one is hematoxylin eosin strains, HNE strains, hematoxylin and eosin. Second one is to strain the glomerular basement membrane. I already told you the strain use is periodic acid skiff. So PAS. It will be PAS positive. And the third one is silver strain. It is useful to strain the reticulin depositions. So it is silver strain. And the fourth one is Congo red. You know it is useful for straining the amyloids. Okay. Now let's discuss some of the terms. Okay. For example, If you take a biopsy, kidney biopsy, in that normally you can see 10 to 15 glomerulus. Okay, make sure you remember this. If they are present more than 15 or if the cellularity is high, it indicates that there is a problem with the glomerulus. Next one is types. And the next most important terms are proliferative. In this, the cellularity will increases in the glomerulus. Next one is focal. If less than 50% of the glomerulus is affecting, it is called as focal. Diffuse. If the 50% or more than the 50% of the glomerulus is getting affected, it is called as diffuse type. Segment. If only a portion of the glomerulus is getting affected, it is called as segmental. And the next one is global. If the entire glomerulus is getting affected in the disease, hence in that conditions we call it as global. Okay, for example, we call this as focal, segmental glomerulosclerosis or diffused proliferative glomerulonephritis. So these are the names of the diseases that are present in the renal diseases. So this is all for today. If you not yet subscribed to the channel, please consider subscribing to the channel today, guys. This is K Harshita signing off. Thank you so much.